According to a new study, compared to WEGOVY, you are more likely to lose more weight on ZEPBOUND. Let me explain. And by the way, this is super important. I'm Dr. Jen. It's good to see you. Okay, this is a randomized control trial, a head-to-head study, a first of its kind done comparing ZEPBOUND, which is the weight loss version of tirzepatide, with WEGOVY, which is the weight loss medication version of semaglutide. Head-to-head study, randomized control trial. The results showed that ZEPBOUND had a 47% greater relative weight loss compared to WEGOVY. Big deal here. And not only that, on average, it led to superior weight loss of 20.2%, which was about 50 pounds for ZEPBOUND, compared to 13.7%, which was around 33 pounds with WEGOVY. 50 pounds versus 33 pounds weight loss. I mean, first of all, let's just call a spade a spade. 33 pounds is a lot of weight loss still. 50 pounds is really quite remarkable, if you ask me. What are the differences between ZEPBOUND and WEGOVY? ZEPBOUND is tirzepatide, the weight loss version. Tirzepatide, the version for diabetes, is called Mounjaro. Remember, there are two forms of most of these drugs. In terms of WEGOVY, WEGOVY is a weight loss version of semaglutide. The diabetes version of semaglutide is ozempic. Okay, so you're following me. Now, the difference between ZEPBOUND and WEGOVY, which are the two medications that were studied head-to-head, ZEPBOUND is a GLP-1 agonist, so it does sort of two things. I'm going to break that down. WEGOVY is a GLP-1 agonist. It kind of only does sort of the one thing, just for simplicity's sake. So what do they do? Well, GLP-1 agonists, basically, they mimic the hormone that lowers food intake and lowers appetite, okay? When you then add that onto GIP agonists, which is what ZEPBOUND is, the GIP part helps not only lower appetite, but also helps improve how your body breaks down sugar and fat as well. So you sort of get that added benefit with the ZEPBOUND versus WEGOVY. Let me be clear again, both of these medications cause tremendous amounts of weight loss. However, in this particular head-to-head study, it shows that ZEPBOUND is superior. And this is not inconsistent with what we have seen before. Prior studies have shown that ZEPBOUND has caused more weight loss. So this does not surprise me. It's really good to see this head-to-head study where they're literally comparing sort of apples to apples-ish, so to speak, okay? Now, this is the thing, this study still has to be published, etc. But I really think this is very, 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 very important information. This is not a call to action to go out and say, hey, doc, can you take me off my Ozempic, or can you take me off my WEGOVY and put me on ZEPBOUND? I mean, certainly you can have that conversation. I'm not telling you not to have the conversation if you wish. What I'm saying is there's going to be more than this information that determines what you are able to take, your insurance, your underlying conditions, etc., okay? I will once again say that these medications as a whole, regardless of which one you're on, they cause really, in my opinion, significant amounts of weight loss, which ones you pick. But thus far, ZEPBOUND seems to be winning out. We will certainly learn more as time goes on. Let me know, by the way, are you on one of these medications? Tell me about it and tell other people about it. Oftentimes what you say helps others. Guys, I'm Dr. Jen Caudle. Please subscribe to my channel. Click the little bell for updates. Follow me on Facebook. I'm on TikTok, Instagram, LinkedIn, WhatsApp, etc. Subscribe to my weekly health newsletter at drjencaudle.com. Guys, I'm Dr. Jen.